for your kidneys, okay? And we want to monitor fluid status. We want to monitor blood levels, creatinine levels. But there was also one that's very important, that if this particular thing occurs, they got to stop it immediately. Look in your book.
What was the question? I'm sorry, I was writing stuff.
Okay, vancomycin. If this side effect occurs, you got to stop it immediately.
Would it be sore throat? No.
That's a super infection.
Is it the ototoxicity?
There we go. Yes, ma'am. So if they start hearing ringing in the ears or problems with hearing, they need to stop it immediately, right? Because it can indeed be ototoxic. I'll go back.
Thank you, Cindy. What, do you know what page that's on, Cindy?
No, I just have it written down. I'm sorry.
Make sure you guys are listening to the lectures, guys, okay? Because all that's in your lectures, okay? All righty. So now your patients are taking an antibiotic, okay? Your patients are taking an antibiotic. Can you give me some side effects that you want them to call you back? Say, if this happens, call me back.
If they have anaphylactic reaction to it?
Definitely, but before they call you back, if it's anaphylaxis, they need to go ahead and call 911, right? Absolutely. What else? What could be indicative of a super infection?
If it gets worse.
Say again?
Rash.
Now that's more anaphylaxis, not anaphylaxis, that's more an allergic reaction. But what's
sore throat
reaction? A sore throat. Okay, let's think about this. Super infection. That means that their immune system is decreasing. So sore throat. What else?
Fever.
Fever. What else could be an indication of a super infection?
Nausea, vomiting.
Okay, nausea, vomiting.
Swelling in their face.
Cramps.
Well, no, not swelling, because the swelling is going to be anaphylactic. We're talking about a super infection. Someone just said it.
Severe abdominal cramps.
Abdominal cramps, and what goes along with the abdominal cramps?
Diarrhea.
Diarrhea, absolutely. So if they're having a super infection, sore throat, increased fever, diarrhea, these are all indicators that perhaps the immune system is decreasing. Okay. What are some side effects of a patient taking erythromycin? I talked a little bit about that in the lecture. Erythromycin. What is something you're going to see?
Nausea and vomiting.
Nausea and vomiting, absolutely. And sometimes the vomiting that you're going to see may be yellow in color, maybe a yellow colored emesis. What medications did I say we utilize to treat anthrax? There was one particular medication in particular that we utilize to treat anthrax.
Cipro.
There you go, ciprofloxacin, that is ciprofloxacin, that is correct. We use that exclusively, ciprofloxacin for anthrax infections. Okay, good deal. There are several antibiotics that we use for UTI infections, several antibiotics we use for UTI infections. Oftentimes, what are those side effects?
Orange urine?
Orange urine, yeah. So a lot of them that we give. So nitrofurantoin, even sometimes we'll give rifampin for UTIs. They tend to turn those secretions, in particular the urine, all kinds of funky orangish, reddish colors, okay?
Bactrim.
Bactrim, not so much. Bactrim can, but not so much. You usually don't. Bactrim is one of those pretty safe ones, even though we do use it for UTIs. Okay. Your patient is a child coming in with an asthma attack. What's the first line of medication you're going to give?
A bronchodilator?
We are going to give a bronchodilator, right? So make sure you know your bronchodilators. We're going to give some bronchodilators. We need to give a oral corticosteroid. We need to give an oral corticosteroid. What are some teaching? You're sending me home on an oral corticosteroid. What are some things you're going to teach me about it? I have asthma. You're giving me an oral corticosteroid. What are you teaching me? I got to use it as a inhaled powder. What are you teaching me?
Shouldn't you drink water?
Drink water.
Okay, we could drink some water. What else?
Rinse your mouth out after?
Need to rinse your mouth out. And ideally, should I brush my teeth too?
No.
Yeah, you can brush your teeth. Please brush your teeth, right? So you want to make sure you brush your teeth real good, rinse your mouth out. Because what could happen if you don't clean your mouth?
Gingivitis?
No, not gingivitis.
No.
It could get like
Caries.
a fungus or something.
Somebody said it.
Caries.
Fungus.
No, not
Thrush.
caries. Come on, somebody
Thrush.
said thrush.
Right.
You can get oral
Right.
candidiasis, right?
Sorry, thrush.
You can have it. You can get thrush.
I'm sorry, there was too many people talking. What was the answer?
You can get
Which-
thrush, oral candidiasis, or thrush. So make sure if they're giving an oral corticosteroid, especially if it's inhaled in nature, you want to make sure you give with lots of fluids, swish, 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 and clean that mouth out and brush those teeth. Brush the mouth out, okay? What is the difference between, okay, remember we talked about allergy medications and we talked about like our first line and our second line. So like our H2s and versus our first lines. What are the difference between the two generations of allergy medications?
Is it the antihistamines and the leukotriene inhibitors?
Along the lines of leukotrienes, but we also have antihistamines and then we have H2 inhibitors. So so between the antihistamines and the H2s, why would you give one versus the other?
So the antihistamines for seasonal allergies
Mm-hmm.
and
But can't we give H2s for seasonal allergies?
yes.
Mm-hmm.
One
So think about why you
limits-
would want to give one versus the other.
One of them reduces the stomach acid production.
No, we're talking about respiratory meds. What was the difference? Look at your notes, guys. What was the difference between antihistamines and your H2s? Think about the side effects. Why would one be indicated versus the other?
Oh, is it you can't give antihistamines to newborns
Okay.
and
Go on thinking, but I want you to kind of think about that. Why would I want to give one versus the other? Look at the side effects, okay? All righty, so let's talk a little bit about those short-acting and long-acting medications for asthma. Remember we talked about our bronchodilators are going to be for immediate exacerbation of asthma, right? So we're going to give them a pump, a little pump up, and then they can work. Then I want you to think about those that cause long-term symptoms. So make sure you know the difference. Which meds we give for an emergency and what do we give for long-term maintenance? You guys got me?
was that for what was that
Asthma?
question for? Asthma?
For asthma medications,
Okay.
yeah. For your asthma medications. And I also talk a little bit about theophylline, and I think the book covers theophylline quite a bit. Make sure you take a look at theophylline, okay? Look at those side effects. When do we give it? Is it short acting? Is it long acting? What are some of those side effects that come along with theophylline? What are some of the things that we should be monitoring when your patients are on theophylline?
Fast heart rate?
There we go. Causes fast heart rates. What else can we monitor? Okay. Sometimes it can cause urgency in urination, polyuria, where patients have to urinate quite a bit. Sometimes because it speeds everything up, so we can have frequent urination. We can have diarrhea. We can have insomnia because it speeds everything up, right? It'll make you wired. So think of everything. Remember we talked a little bit about sympathetic versus parasympathetic. It's going to speed everything up. Okay. Also, we talked about your leukotriene medications. When should we give those? Are those morning meds or evening meds?
Those are best in the evening.
Those are usually going to be evening medications, 9 p.m. So those are usually going to be evening medications. Okay, and most times they're just oral pills, nothing major. okay? And they are also for long-term maintenance. So if it's an active asthma attack, those are not gonna be your go-tos. Which classes are gonna be your go-tos for active asthma attack?
Antihistamines.
No, for active asthma attack.
Bronchodilators.
The bronchodilators. Those are where you're gonna go if your patient's having an active asthma attack. Thank you so much. Okay. All right, let's move on to some GI medications. Let's move on to some GI meds. Remember, we talked a little bit about your antacids. We talked a little bit about your antacids, especially those antacids that contain magnesium versus those that contain aluminum. So for those that contain aluminum, what are the side effects? Aluminum tends to stop you up a little bit, right? It's gonna slow everything down. So having said that, what would be a side effect of an aluminum-based antacid?
Constipation.
Constipation. Versus our magnesium-based, what do they cause?
Diarrhea.
Yeah.
They're gonna cause the poos, okay? Also calcium-based ones can cause a little flatulence, a little gas, okay? And lastly, those that may contain some sodium bicarb. Those that contain some sodium bicarb can also raise blood pressure. They can raise blood pressure. What time of the day should we give an antacid?
Before lunch, in the morning.
Before they eat, for the first morning meal.
Okay, if we know it's going, especially if we know it's a food that's going to worsen those gastric symptoms, correct? What else did I want to say? Okay, your patient has to take a laxative. What are you teaching me about? I got to take some laxatives. What are you teaching me about?
They need to stay hydrated because the laxative can cause dehydration.
It sure can. So I need to stay hydrated. If I use too much, if it causes dehydration, what else is going to be out of whack?
Electrolytes.
My electrolytes. So I got to make sure I'm monitoring my electrolytes, right? Should I be using laxatives for long-term use?
No.
No.
No, because what can it cause? Rebound.
Rebound diarrhea.
Not diarrhea, but
Constipation.
constipation.
You're gonna have to depend on them.
Because they have to depend on them, absolutely. So if I don't take that laxative, then all of a sudden I'm going to be constipated. Okay. Let's see. Let me take a look and see what else. Also, if my patient's having problems and they have to take a laxative, what kind of dietary instructions are you going to give me? What should I be eating?
A lot of water.
I should be drinking lots of water. What kind of food should I be eating?
Fiber.
Good fiber foods, right? So high fiber foods. Okay, I think I talked a little bit about those coating agents. Remember we talked about when the patients have PUD and they have to drink those coating agents like carafate or sulfate. They should be taking those when, if let's think about this critically. I'm taking a medication to decrease hydrochloric acid and I'm getting ready to eat. So when should I take or drink that medication?
Before they eat.
Before you eat, because you want to start coating that stomach before.
Isn't it an hour before or 2 hours after?
This one actually should be before.
Okay.
Yeah, this one should be before. You don't want to do it after because that's, that's kind of too late. By then the hydrochloric acid is going to start churning the stomach and it's going to give some pain at that point. Okay. So ideally about an hour before. All right. Is it okay if I have GERD or problems like that? Should I have cold things in my stomach? Think about hydrochloric acid and cold things. That can actually worsen and cause cramps. So people should, if they have, issues with GERD, try to eat and drink things at room temperature. Okay. What about if you take medications with an antacid? How do you think an antacid is going to affect the absorption of medications?
Decrease
It's
it,
going to
decrease
the
the,
absorption.
It's probably going to decrease the absorption rate. So should we be taking antacids with anything?
no.
No, try not to. Try not to. Okay. All right. I'm constipated. What medications do you? Oh well, hold on. Before we start with medications, I'm constipated. Okay. So what are you going to tell me to do first?
We're going to advise you to eat fiber and drink water before we take any medication.
Absolutely.
Drink water, and also if you're able to ambulate, walk around some.
Ambulation. How about some coffee?
Coffee is good.
Coffee's good. Prune juice. Anything that'll get the GI stimulated. Okay.
I thought
So now-
coffee was dehydrated like tea.
It can, but we're talking about a constipated person, not a patient that's having electrolyte imbalances. Now, if they happen to have electrolyte imbalances and they're still constipated, then we wouldn't give. But we're just treating constipation right now. Okay. So now, if they are indeed constipated, and say walking doesn't work, and water doesn't work, and fiber doesn't work, what might you suggest I do now?
A stool softener?
A stool softener, that's absolutely right. So let's go with a stool softener. And once the stool softener kicks in, what expectation should you see? In other words, how do you know that the stool softener is working?
You should be able
They
to
have a bowel movement.
You should be able to have a bowel movement. And the bowel movement should be what? Nice and soft or hard, or what should it be?
soft.
Okay, absolutely. Should be soft. And how long usually do they take?
Maybe a day or so.
About a day or so. About a day or so. It shouldn't take like 3 days or so. That's too long. That's way too long. Okay. Now, one thing about stool softeners, they normally do not cause diarrhea unless, of course, you're taking way too many. So if you just take one, give it a chance to work, you should be absolutely okay. And if the patient should drinking water, should they be drinking lots of water?
Yes, lots of water.
Good deal. Good deal. Okay. I think I mentioned a little bit about H. pylori and its precursory dealings with stomach cancers and the such. So if your patient does have a gastric ulcer, and that gastric ulcer is tested for H. pylori, which is that bacteria that predisposes our patients to to gastric cancers, make sure that they are taking antibiotics along with it. Okay, so if they are positive for H. pylori, they need to make sure that they are taking antibiotics along with that H. pylori. Okay. All right. What kind of medications should the doc prescribe for a non-productive cough? Non-productive cough. I talked about non-productive versus productive. What kind of medication should we give for a non-productive cough?
Expectorant?
Antihistamine?
Not
Yes.
expectorant. Expectorant's for a productive cough. Somebody
Oh. Antitussive?
An antitussive, absolutely, an antitussive. Those are the ones we're going to give for the non-productives. Expectorants is for the productive cough because you want them to get that gook out. Okay. And how do antitussives work?
Works directly on the brain.
Works directly on the brain, absolutely. So they're going to work on the cough centers of the brain to tell the person to stop coughing. Okay. Do you want a person that has gook in their chest to stop coughing?
No.
No, you want them to get that crap out. So that's where you're going to give them those expectorants. And you can even maybe give them a decongestant to break some of that up. Okay. Tetracyclines. Look at some side effects of them. What are some side effects of tetracyclines?
Vomiting,
Nausea and vomiting.
loss of appetite,
Loss of appetite.
headache,
Darkening in teeth in kids?
Say again?
Sunburn?
Darkening.
Okay, photosensitivity, sunburn. Sometimes
dizziness,
patients feel
headache,
a little bit of vertigo. Sometimes patients can feel a little bit of vertigo. Okay. Sometimes they can feel a little bit of a vertigo going on. And if they are at risk for vertigo, if they had a side effect of vertigo, what are you concerned about?
Them falling.
Them falling. So safety becomes an issue. Safety becomes an issue for these patients. Look at some contraindications, guys. Look at some contraindications for sulfonamides. Look at some contraindications for sulfonamides. Look at what medications would we not give. Okay. Your patient is taking some amoxicillin. Your patient is taking some amoxicillin. What foods should they avoid when taking amoxicillin?
Dairy?
Citrus.
Somebody said it.
Dairy?
Citrus.
Citrus juices, right? Orange juice and grapefruit juice.
Yogurt, cheese. Yogurt.
Yogurt and cheese, well,
Mm-mm.
no, not a contra. Not a contraindicated. Not a contraindication. Your patient is on Reglan or metoclopride or Reglan, okay? And they're on it for, it kind of acts like, you know, as an anti-nausea medication. It can act for those that are having chemo. What are we concerned? If we're giving Reglan, there is a very serious side effect that I talked about that you really, really want to watch for.
Tardive dyskinesia.
There we go, along those lines, that tardive dyskinesia. Tardive dyskinesia falls under what we call EPS or extra pyramidal symptoms. They all go under those EPS or extra pyramidal symptoms. And what does tardive dyskinesia look like?
Constant movement of the face.
Okay, so they do that ticking of the face. What about the fingers?
Is it pill rolling with the
They
fingers?
do the pill rolling, absolutely. So they may have some tremors, maybe also have some difficulty standing, so they kind of sway just a tad. So all of those fall under the auspice or the umbrella of extra pyramidal symptoms. Okay. Let's see. I think we've done, yeah, we've done that already. Okay, I come to you guys, I'm in the clinic and you got to give me an antibiotic and I am allergic to penicillin. So what group are we going for if I'm allergic to penicillin?
Like erythromycin.
Okay.
Amoxicillin.
Now, usually you got to be careful with erythromycin. You got to be careful with erythromycin because sometimes if you have penicillin, it can still, because it's still in the same vein, because it ends in still, well, it doesn't end in mycin, but sometimes you got to be real careful with that one.
Bactrim.
Okay, we can do some Bactrim.
You can give amoxicillin if someone is allergic to penicillin.
Amoxicillin is usually where we want to go, ladies and
Oh,
gents, especially
man.
in a child.
Can you not hear me, Dr. Ross?
No, I didn't hear
Sometimes
you.
it's a
Y'all all
child.
talking at the same time. I can't hear you.
I apologize.
No, that's okay. So amoxicillin, absolutely. So we can go with an amoxicillin, especially in a child, right? We can go with some amoxicillin. Okay. What else did I want to say? Yeah, we already talked about that. All right, your patient has genital herpes. Your patient has genital herpes. Talk to me. What kind of meds can we give for genital herpes?
We can give a cyclovir.
Acyclovir, absolutely. We're going to give some acyclovir, okay?
Valsite.
What's that?
Valsite.
Okay, Valsite. But the most common one is going to be your acyclovir, right? Or your Vorax, right? So that's the one, Zofarax, that's what we're usually going to give, okie dokie. So when you get this, excuse me, when you give this, what are you asking your patient? They have genital herpes. Let's talk a little bit about that. What are we
Do
asking?
they have any open lesions?
Open lesions.
Sexually active?
That's why they're coming to you. So open lesions. What else?
Are they sexually active?
Sexually active, and if they are, who do we need to notify?
Their partner.
No, not us. We don't do that.
The CDC, is it the CDC?
CDC.
Well,
The health department.
Health department.
the infectious disease doc is going to notify the CDC, right? Well, not the CDC, the health department.
Health department.
Health department,
But we need to ask them if they're taking any hepatitis B medications or HIV medications.
Absolutely, because a lot of times patients that may have, say, active Hep or HIV, it can predispose them to these, to herpes simplex, because anytime they have HIV or they have, say lupus or anything that happens to compromise the immune system, it will predispose them to viral infections, okay? One other last thing, when they're taking a cyclovir, you always want to ask about milk allergies. You want to ask about milk allergies because those are contraindicated in patients that are giving a cyclovir. So if they have, allergies to milk, we got to try to hit them with another antiviral. What type of medications do we use to treat HIV? There was a class that I talked about.
Antiretroviral.
Antiretrovirals are going to be those that we utilize to treat HIV. Okay. We talked about fluoroquinolones. There was a particular side effect that I talked about. It was a particular side effect I talked about.
Tendon rupture.
Fluoroquinolone. Say again?
Tendon rupture.
Tendon who?
Tendon rupture.
Tendon rupture, absolutely. So if they start complaining of pain in those joints, bleeding, if you see some dark bruising in those joints, they got to stop that medication, right? Let's see. We talked about that. Bronchodilator. Let's talk to me about it. Patient has asthma. I'm having an asthma attack. You give me a bronchodilator. What do you expect to happen? What is the bronchodilator going to do to the body?
Wheezing.
So it should decrease wheezing. What else is it going to do to the body?
Increase heart rate.
Okay, it's going to increase heart rate. What else should it do?
Respiratory rate.
Okay, so it hopefully should decrease the respiratory rate. What is it going to do to your airways?
Open them.
Open them up. And if the patient has an asthma attack, usually they're going to probably cough, right? Because they're feeling all of that mucus built up for the inflammation. So if you give a bronchodilator, should we see a decrease in cough levels?
Yes.
Yes, absolutely. Talk to me about giving, you're teaching my kid about administering a bronchodilator through asthma pump. Talk to me, what do we need to do?
Put a spacer.
Okay, for a spacer, but let's talk to me through the whole process. I have my little pump here. What am I doing first?
Exhale all the air.
Right.
Okay, well, I gotta shake it up first, right?
Shake it up.
Exhale all your air out.
Shake, exhale all my air out.
Take a deep breath.
Somebody in the car, y'all supposed to be paying attention, y'all in the car. Okay, so take a deep breath out, right? I'm gonna get all my air out, right? And then what?
Then press the pump.
Then press my pump, and then what do I do?
Inhale all of that.
As deep as humanly possible. Now, if it's a kid and you have a spacer, then your child can breathe in and out, breathe in and out. But if it's an adult, they don't really need a spacer, right? Adults can follow directions pretty well, right? So they're gonna breathe in as deep as possible, correct?
Mm-hmm.
All righty. And how long should they hold their breath to get that good air in?
A minute.
Oh, no.
10 seconds.
Hold your breath. About 10 seconds.
Yeah.
Let's go ahead and hold your breath for about 10 seconds. All right. Okay, ladies and gents, so that's your review. Anything that you weren't quite sure on or weren't quite clear on, make sure you go back in, ladies and gents, and listen to the rest. A lot of that stuff I'm doing hint, wink, winks for you.
Okay.
All right, babies. Well, good luck for tomorrow. You guys got it. Positive thoughts, positive vibes.
Thank you, Dr. Ross.
Oh, you're welcome. It is indeed recorded. I have recorded it. Yeah. Well, let me see if I can try. I can try to throw it on YouTube tonight. Hopefully, tomorrow. I'll go ahead and throw it on YouTube for you. Okay. It'd be awesome if you could throw it on YouTube for us.